doing a little day in the life of a patient care tech today. Today is one of my last days of work before I start my first semester of my senior year. I am halfway done with nursing school. This is my second of 3 so far this week. I work 3 12s in a week. I work 7 a.m. to 7 p.m. So I am a float tech at a pediatric hospital. So every morning I wake up and find out where I'm going to be for the day. So if I'm in the ER, I usually have to be there a little bit earlier. So I set my alarm for 5:45 every day and just kind of look at my texts that I get. We are going to the PICU. And usually when we go to the PICU, that means there was an overdose. So I will most likely be doing a one-to-one with an overdose kiddo. I think I saw her yesterday when I was in the ER as a trauma that came in. So I'm guessing that's her, but we will find out when we get there. So it's 6:35 right now. We are going to head to work. It's about a 20-minute drive. Okay, so like I said, I do work at a pediatric hospital. Basically, when I say that I'm a float tech, that means that I have been trained on every unit of the hospital. And every shift that I work, I don't know where I'm going to be or what I'm going to be doing, which I really enjoy because it gives me great experience being in nursing school. I absolutely recommend if you're in nursing school and don't know what specialty you want to be in necessarily, be afloat, whether that's with adults, kids, whatever it may be. Just try to get as much experience as possible because that is literally the best way to figure out what you want to do. But at my hospital, we don't have very many units and everything is a lot smaller. So I've only been there about 4 months, but I feel like I've met just about everybody and feel like I know everybody, which is really nice because everyone knows I'm in nursing school. Everyone will show me stuff that they think is cool or let me try things, which is awesome. Our units that we have are the PICU, pediatric ICU, emergency room. It's about 25 to 30 beds depending on the day. We have 4 units of acute care, which I just call like regular inpatient. They kind of do a little bit of everything: post-op surgery, recovery, respiratory things, pretty much anything. An eating disorder unit, and then we also have a surgical center as well. So get to be on all of those. My favorite's probably the emergency room, just because I can do the most stuff. I'm also specially trained as an extra behavioral health resource. So when we have kiddos that come in and state mental health concerns or aggressive behavior, sometimes autistic behaviors fall into this as well, and also eating disorder behaviors absolutely fall into that. We will be sent to sit one-to-one with them, and I have lots of feelings and emotions when it comes to this because if I end up doing this my 3 days every week, it can be very exhausting just sitting with one person in their room or in the hallway. I am not a person that can sit in one place all day, so this has been very challenging for me. I do love what I do. I feel like I make an impact, and a lot of times I get to spend a lot of time with these kiddos, and so I make a good relationship with them, and it ends up being very rewarding. It is just sometimes very difficult, and sometimes it comes with a lot of unwanted behaviors as well. So often when I'm in the PICU, so we'll see how today goes. I try to be transparent with how it actually is. I want to show what my day is actually like, but I feel like I love my drive to work. It's so beautiful, just with the sun rising, but it's a little overcast today. delayed my time on the way home to eat the rest of my snacks. I did not get to eat today because I don't always get breaks like I would like to. I could not have been more wrong, and I usually am when I say stuff like that, on what my patient was going to be. It was not an overdose. A lot of like med-related things. There's a lot of family pushback from some of the rules, I would say, because when we are doing, it's called CVO, constant visual observation, which is a one-to-one sitter, so one patient with one staff member inside the room, and it has to be a safe room when you're doing constant visual observation, no matter what the reasoning for them needing that is. It means that we have to take out a lot of the cords, harmful objects, sharp objects, obviously, and take a lot of the belongings away from the patient, and we keep them locked up. Parents have to follow this as well, and we just had some compliance issues with that today, and by issues I mean a lot of issues, but it was an excellent lesson in a lot of different things. Covering yourself, I would say, with charting, and making sure that you feel comfortable with the care you've provided and charted. Super important, especially when family members file complaints, not necessarily about you, but just in general with things going on. You always want to make sure you're covering yourself no matter what role you're in. So that was a great lesson in that for me today. Learned how to do some notes, like progress notes, which I don't always do, so that was nice to get a little bit of guidance on. And also just how uncomfortable sometimes situations can be in healthcare, and how you just kind of have to, roll with what you are being given, but stand your ground, and just know the rules, know the policies, know your hospital's policies, and always, of course, keep in mind what's best for your patient. So hopefully you guys were able to see kind of how my day at work went. We moved my patient from the PICU to the acute care, which is not really super different, just a new nurse, new staff, new rules sometimes. So we did that, and then my patient all day was not medically cleared to go to an inpatient facility just yet, so we didn't get to do that process. But usually during my days where I'm sitting with kiddos that are going inpatient, it's usually a process to find a bed, because as we know with COVID lately, just our mental health crises are up. I usually don't take lunch until like 2:30 or 3, just because I'm like to spread out my day, and it's so hard when you're sitting in the same room for 12 hours. You want to spread your day out as much as possible, because after I eat, I'm like, it's nap time, so where's my bed? And I can't do that obviously when I'm at work. So all in all, I do love my job. This is just was such a hectic day. It's a lot. It's emotionally a lot. It's not really like physically a lot. I will say that some days I get to do a lot more than what I did today. I'm in the ER. I get to do EKGs and do splints and drawing labs, putting IVs in, that kind of thing, which I'm slowly getting more and more comfortable with. It is very difficult. Putting IVs in it's just a difficult thing, as is, and then trying to do it on a kid that's scared, and then also a younger kid where they're screaming and fighting and kicking you, and then little babies. My hospital doesn't have a lab team that comes and draws labs, so we do them on our own between the techs and the nurses. So get lots of great experience there, which is awesome. But that's pretty much it. Just waiting for Jared to show up. We'll go to his game. usually gets home before I do, by a little bit. So he makes dinner, so I come home, we have dinner, and sometimes we'll take Sadie for a walk, especially now that it's been staying later. It's easier to take her out for a little bit of a walk before it gets dark. So then we do that, kind of hang out. Lately we've been watching a lot of hockey because it's May, and so it's Stanley Cup playoffs, and that is Jared's thing, so we watch a lot of hockey. And I will be doing homework very shortly to pass the evenings. That's kind of what we're gonna do tonight. It is late now, it's almost 10, I believe, 10:30. So I'm going to end the vlog here. I just wanted to say thank you guys so much for watching. Like, comment, let me know what you think, things you want to see, questions you have for me, and please subscribe and share, especially if you know someone that's in nursing school, because I feel like I have a lot to share. So thank y'all. See you next time.